This lecture covers some renal topics. We'll discuss a renal fusion known as horseshoe kidney, where if you know what the shoe of a horse looks like, you can understand the name. Note that the horseshoe is positioned like the letter U when it's right side up. In other words, the opening is at the top. Horseshoe kidney will allow us to review some gross anatomy as well as chromosomal aneuploidy. For anatomy, we will locate the inferior mesenteric artery. The aneuploidies we'll discuss are a monosomy, namely Turner, and the three least bad trisomies, Down, Edwards, and Patau. Edwards is trisomy 18, and Patau is trisomy 13, is correct. At the top of the kidney, we have the superior pole. The bottom is the inferior pole. In horseshoe kidney, the inferior pole of one kidney is fused with the inferior pole of the other. This is why it looks like the letter U instead of the letter capital omega. In the fetus, the kidneys are formed low, and they rise during development. If the kidneys, as in horseshoe kidney, are not separate, this U shape ascends, but then can get hooked on the inferior mesenteric artery. So a horseshoe kidney can remain low in the abdomen. Just to review the circulation quickly, you know that blood leaving the left ventricle goes to the aorta, ascending, then arching to the left, then descending. Then crosses the diaphragm, this is quite low, about T12, to leave the thorax and enter the abdomen. Here in the abdomen, the arteries that supply gastrointestinal structures are single and branch from the abdominal aorta anteriorly, whereas the ones supplying the adrenal glands, the kidneys, and the gonads come in pairs and branch to the sides and posteriorly. So the celiac trunk is single and comes out anteriorly, right there at T12. Superior mesenteric artery is next, also not paired, also anterior at L1. Then inferior mesenteric artery, anterior and single like the others, at L3. So anyway, this is how a horseshoe kidney gets stuck as it tries to ascend, on the IMA, which comes out at L3. Also recall that the inferior mesenteric artery supplies the distal third of the transverse colon, the descending colon, and the proximal two-thirds of the rectum, with watershed regions at the splenic flexure and the rectosigmoid junction. Okay, switching gears for a moment. To coarctate means to press close together or contract. If a patient has coarctation of the aorta, if you palpate the brachial and femoral pulses simultaneously, you may find that the femoral pulse is delayed. Also, it will likely be decreased, or it could even be that you can't feel it at all. So for pulse grading, and the top of our scale for that is 4+. At the femoral, they could have it 1+, which is weak, or even 0, can't feel it. A patient with a broad or square-shaped chest with widely spaced nipples can be said to have shield chest. And hygroma is a word that ends in oma, so it's some kind of mass, and it starts with the word hygro, which word root just means moisture or fluid. So to my ear, the name cystic hygroma sounds a little redundant, but it's a fluid-filled sac, and it happens from blockage in the lymphatic system. The most common location for cystic hygroma is in the neck or head. So, aortic coarctation, shield chest, and cystic hygroma should make you think of, yes, monosomy X, which we call Turner syndrome. Next, what is microphthalmia? It's a birth defect where the eyes are small because they didn't develop fully. How about cutis aplasia? Aplasia means it didn't grow, and cutis refers to the skin. So some skin is absent, most commonly the scalp. It's possible some underlying structures are also missing. And renal dysplasia involving cysts, often in the tubules, I think, is another thing that can show up in trisomy 13, which is known as patau. Again, microphthalmia, aplasia cutis congenita, and renal dysplasia were the three I chose to mention here. Okay, what about brush-field spots? That is, small whitish or grayish spots at the periphery of the iris from aggregation of connective tissue. Hirschsprung disease, a congenital condition where the muscles of the colon are missing nerve cells. Gap between the first two toes, which we can call sandal gap. If you saw those three, you might think of trisomy 21, that is, Down syndrome. And of course, I'll include Edwards, which is a trisomy of which chromosome? 18. Clenched fists with overlapping fingers is one trait. Also, micrognathia. What is that? The lower jaw is undersized. And a third trait for trisomy 18 is myelomeningocele, which is a neural tube defect and as such could easily have a detour of its own. Remember, neural tube defects can happen if mom has a B9, a folate deficiency, going into pregnancy, and we can consider it one of the more severe forms of spina bifida. I've also heard it called meningomyelocele. The seal part at the end of the word is trying to tell you that something has squeezed out of where it normally belongs. The meningo part is easy. It's the meninges, the three membranous envelopes that surround the spinal cord. You also know they surround the brain. And the myelo part refers to the neural tissue of spinal cord, or the cauda equina. So meningomyelocele is more extreme than meningocele, where it's only the meninges that surround the neural tissue that come out. So yeah, just a quick review of the chromosomal aneuploidies: Patau, Edwards, Down, and Turner, including phenotypic presentation we can see in each one. Horseshoe kidney has a higher incidence in chromosomal aneuploidy. Here's a CT that kind of looks coronal but is actually oblique. This was done with contrast and taken about 15 to 25 seconds after injection of that contrast, so the contrast is still in the arteries at this time, which is then called arterial phase. So this is an oblique CT with contrast in arterial phase. In spite of unique shape and low position, horseshoe kidney can function normally. It is associated with things like ureteropelvic junction obstruction, nephrolithiasis, and infection. In case this is the first time you're hearing of the ureteropelvic junction, that's between the pelvis of the kidney and the tube after it, that is the ureter, which leads to the bladder. Okay, let's tie it all up. Fusion of the inferior poles of the two kidneys makes horseshoe kidney. It can remain low in the abdomen because of getting caught on the inferior mesenteric artery as it ascends. The IMA protrudes anteriorly from the aorta at L3. Horseshoe kidney is associated with aneuploidy. A patient with little spots on the iris called brush-field spots, also Hirschsprung, and also a sandal gap between the first two toes, and also horseshoe kidney. All of these things would the patient most likely have Down syndrome, trisomy 21. If you had a patient with aortic coarctation, cystic hygroma in their neck, shield chest, and horseshoe kidney, they would most definitely have Turner syndrome. So with respect to sex chromosomes, they could be XO. Clenched fists with overlapping fingers, myelomeningocele, so both meninges and neural tissue coming out via a defected bone, and undersized lower jaw, micrognathia that is, and a horseshoe kidney. Which one is it? That's going to be Edwards, aka trisomy 18. Renal dysplasia with cysts, small underdeveloped eyes, microphthalmia, missing skin on the scalp, aplasia cutis congenita, and horseshoe kidney. This is Patau, which is a trisomy of the 13th chromosome. The renal function of horseshoe kidney is often normal. It does have an association with ureteropelvic junction obstruction, which could of itself account for its other associations with nephrolithiasis as well as infection. Okay, that's it for this one.